Welcome to, that was funny. Welcome to Parenting with Vanessa Colon. We are going to be talking about ways to work with children when it comes to spitting and biting, my favorite topic. So I want to give a little background from when I started in the field, which was a very long time ago. So we're just not going to do addition or subtraction right now. So no one's going to add those years or minus them. I started with a little boy who had autism, who was completely nonverbal. And one of the things that I was told all the time was that we need to ignore certain behaviors, always. So that's what we call extinction, ignore. So when things come up, we will ignore certain stuff. But this little boy, since he was nonverbal, out of nowhere will start screaming and crying, and yet I was supposed to ignore that, which some people would do a really good job listening to the supervisor, but I sometimes don't listen to people all the time, especially when I didn't feel right for me. So there was times when, we would be doing like walking him in a wagon and he'll start crying, and to the point where it was like he was in pain. So I would just hold him. And within those times of him being sick, come to find out, 6 months later down the road after all these tests, that he actually had some major gut issues where he was in pain most of the time. But there's a lot of like throwing up. There's a lot of things that, if I didn't get him to the bathroom in time, it would be on me. So for this amount of time working with this little boy, I just kind of got used to like spit on me, throw up, whatever it is, because that was just part of the job. And what is, when you have someone who's sick, you just hold them, in my opinion. Not everybody's going to be doing that, I don't think, but I would hope as a good person and you see someone suffering that you would actually, help a child that way. But since then, I do get spit on a lot, and I have in the past. And, this has come up in a couple of schools that I've been working at, because I have a couple of 4-year-olds that, teachers are like, stop spitting, no. And just completely not I want to say exploding, but giving a lot of attention to a child who is 4 years old, who thinks it's funny now. He's like, ha ha ha, I'm going to keep spitting, right? One of the things when it comes to spitting is ignore it. I don't see what the problem is. Well, there is a problem with the kids spitting and biting, but if you keep giving it attention, they're going to keep doing it some more. So do you want to look at decreasing the behavior or increasing the behavior? So if you're going to start yelling at your child for spitting at you when they think it's funny, they're just going to keep doing it. They just think it's hilarious. Look at that reaction I just got. It happened 2 weeks ago. I had a little boy, and he just started spitting at me, which, by the way, I've been working with him for 6 months, and he's never spat at me. He's never done anything like that. And the teacher goes, see what I deal with? This is what I'm dealing with all the time. And then the little boy looks over at the teacher, and I just got it. Like, he just kept going and going, and I just sat there, and I'm like, okay, are you done yet? No, I'm not done. I'm like, okay, keep going. And it's probably not what most people are going to do, but I'm not going to give it attention, and I'm not going to do it. And I said, you can go in the bathroom and spit in there, and then when you're ready, we can go out. So I just redirected the behavior to go spit somewhere else, and he's never spit at me again. He'll go, I need to go spit in the bathroom, and he'll go spit in the toilet or the sink. And I also have a wonderful thing called a spitting cup. And I have teachers use it in classrooms too. And one thing that you can do is have a cup that children can spit in when they are just having one of those moments of just wanting to spit at you. So I'll just say, okay, if you want to go spit in the cup. It's the same thing as when a child is cussing. I'm going to say, okay, here is a cuss cup. If you have something to say over and over again, keep doing it in the cup. So once again, I'm not saying don't do it. I'm not giving it attention. I also am, they are doing what they need, and maybe there is a sensory input that they might need. So talking to a speech therapist or an occupational therapist around that will be really beneficial. But if a child's spitting, don't engage in it. And there's times, I have a story with this little boy, a little boy from here, but we're not going to say who, when he was 5, decided to come into my house and was like, you're not going to tell me what to do. And he thought by spitting in my face over and over again, that was going to stop. And I just was like, are you done? To the point where there was no more like anything to come out. And then he just looked at me and goes, yep, I'm done. And that was it. Never happened again. So these are the things that you got to look at and like, okay, if he keeps doing this and I'm not reacting, my goal is to get him to stop. And if I actually got him to stop, was it that the worst thing? Or to have him spit at you a couple more times? Think about it, right? You want to look at how are we going to decrease the behavior. I was talking to a teacher and he's like, that's just so gross, I can't handle it. And I had another teacher before that was here that was like super OCD about germs and everything else. And it's just, to me, I explained to a teacher, I'm like, how many times have you gone out to a bar in your early 20s and you met somebody and kissed them? To me, that seems so gross right now. You don't know where that mouth's been. A 4 or 5 year old, okay. Also, between 0 to 3, developmentally, that's appropriate. Some kids might spit, not realizing it. Don't react. Just keep it down. And the other thing that keeps coming up for me is biting. I don't understand what's happening. I feel like it goes in waves with some of my kids that I do consultations with. So the last 3 families that I've had is like, well, my kid's biting. Number one, I want to explain something about biting. Do not pull away when the child has his teeth on your body. Do not do it. Just push in. It's very simple. Open the jaw. It's like a dog. When a dog comes after you, you want to push in, open the jaw, you release. But everyone's like they want to just completely, they react, number one, which is very normal. By the way, it's very normal. But let me tell you something. Once you push in, that child's not going to bite you again. They're going to be like, what just happened? Don't bite the child back. I've told parents, like, I'm just going to bite him back so he knows how it feels. No. We don't need to do that. We don't need CPS coming. You don't need to be doing any of that stuff. You want to be push in, ignore, right? And also look at what I would call what happened before the behavior happened, right? So was he frustrated? Are they mad? Most likely, if it's a child that's nonverbal, that's his way of getting his mads out of like, I'm going to bite you. So if you know that's going to happen, you want to be able to give space between, maybe his peers when they're playing and give them the language if they need it. Or having like a break card or something out to be able to say, I need a break or I'm mad, that they can express themselves instead of biting. But understand that biting, push in. You have to come first on like making sure that your body's protected on that. And also you want to look at why are they doing it? And that's key to it, because if you don't know why they're doing it, they're going to keep doing it. But don't react again. Like, once again, this is all about not reacting. This is like, okay, I have a kid biting my arm and it's like really painful and you're just like, and you're pushing in and you're just like, okay, good. And then you can just lift that nose a little bit up and that thing your arm's going to come right out and it's like nothing. No mark, you're good. But the minute you start to pull and you guys are getting in that tug of war between his mouth or her mouth, there's the problem. Ways to look at that to help with it. You got to look at transitions. Is he biting around transitions, or him or her? Did you say it's time to clean up and it was too soon? Did you give time for that? So you got to start looking at, okay, why is my child biting? Is he biting his peers? If biting his peers, you want to make sure there's some space between him and his peers, and like maybe modeling language when you think it's going to happen. Start paying attention to what they're doing. But understand that, once again, we talked about 0 to 3, teething, everything else, that stuff's going to happen. Fine. Don't react, right? And stop talking about it. They know what they're supposed to do. It's just like spitting. Are you done now? Okay, let's go. Let's move on. We're just going to keep on moving forward, keep going on to whatever's there. The minute you start lecturing and talking about it, the more you're going to have a kid that's doing more of these behaviors. So you really want to look at, how do we get kids to communicate their wants and needs, whether it's through, a nonverbal card to say I need a break or I'm mad, versus having someone's, that way, or being able to physically move the child if you know that they're going to be coming close. But you want to just look at the whole picture of what's going on and why they're doing it. So why are they doing it beforehand? Once you find out what that is, how can you prevent that? And don't ask a child to say, use your words. Give them the words if they don't have it in that moment. Because when a child takes something from them, they really want that toy back and they're going to bite. Instead, just put your arm right next to them, block the bite, like block the body a little bit, give them the language, and then move on and keep working on that. Because the more the child has a chance to use their language that you're giving him and where he's going to get his needs met, that's going to help a lot. But I'm telling you right now, the more attention you give to a child when it comes to spitting or biting, the more he's going to bite you. They're just going to keep doing it. And they're going to keep spitting in your face. And it was just like yesterday, I was with a kid and I was holding a cup, his water or something like that. I did something and I had my head turned over and he spit on my hand and I was going to ignore it. But the teacher across from him, see, look what he's doing. And I'm just like, please stop. And the kid starts laughing and I got it again. So here we go. You see the cycle. Laugh. We don't want to laugh. No one's probably laughing at spitting, but like, I have to make a joke out of it because what are you going to do? These are children. But these are children learning how to use their words and they're learning how to express themselves. So these are the ways that they're going to do it. But if you're looking at them only getting negative attention and that's where they want to get their attention, this is the problem. So we want to switch it to something positive. If they're spitting, they can go spit in the toilet. They can go spit in a cup. Cuss words too. When someone wants to call me a name, there's your cuss word box. Or, you can have the cup. That works really well. When I was a kid, my dad actually gave me a cuss bank box and I had to put money in. I still have it on my desk right over there. If I go and walk away, I'll be 2 seconds. That no one will be here and I might lose you, so I'm not going to do that. But enjoy. Is there any, and I have Carrie here, anything I'm missing on that? I'm bidding is fine. Nope, I'm good. She's like, I don't want to talk. All right, next week we're going to be on again. I'm going to try to do this once a week on Parenting with Vanessa Colon. Any questions or anything, just send me an email. Someone did mention that they've gone through biting and spitting and now their child is peeing. So I'll be having a conversation with that parent. Anybody else have any feedback or anything else, please send me.